Hey everyone, my name's Hayden Adair. Today I'm going to be talking about generalized anxiety disorder, which is commonly abbreviated GAD. I chose to talk about this subject because we covered MDD, major depressive disorder, in the lectures, but we didn't talk too much about the anxiety disorders that are common, so I thought it'd be cool to research and look into and talk about one of them that's more common than the others, which is GAD. So, some learning objectives today is explain what GAD is, explain how GAD can be diagnosed, explain what is happening in the brain of someone with GAD, as well as describing the treatment options that are available for someone suffering from GAD. So, what exactly is GAD, generalized anxiety disorder? So, the DSM-5 defines it as a disorder that's persistent and excessive anxiety and worry about a number of domains in the person's life, present for at least 6 months. So, how exactly is it diagnosed? So, the DSM diagnostic criteria that they list a variety of symptoms, and they say that you need to experience at least three of these for at least 6 months. So, the key word is at least 6 months. A lot of these symptoms can be experienced by everyday people. Everyone has anxiety, everyone experiences certain symptoms, but if they are consistently happening to you and you don't find any relief from them, then that's when it might be time to go into a physician and get checked out. Some of these symptoms that are more common with the disorder is restlessness, being easily fatigued, difficulty concentrating, irritability, muscle tension, and disturbed sleep. So, when you go into a medical professional, they'll often screen, do blood tests and such for physical examination to make sure there's no other medical condition that's at play causing these symptoms. They'll also have you do psychological questionnaires to evaluate how long you've been feeling these symptoms and what you've tried to help and how long they've been persisting for. So, what's exactly happening in the brain of someone with generalized anxiety disorder? First, there's hyperactivity in the amygdala and insula. These are parts of the brain that are involved in the emotional processing and also the fear response. So, the amygdala goes crazy when you're in fight or flight mode. So, hyperactivity means that you're feeling a lot of anxiety as such of the disorder is called. Also, there's decreased connectivity between the prefrontal cortex and the amygdala. So, the prefrontal cortex is often involved in decision making and regulating emotions. So, because of the decreased activity and the increased activity in the amygdala of the emotional responses, the prefrontal cortex isn't able to make the correct decisions with these emotions. There's also neurotransmitter imbalances, such as serotonin and dopamine, as well as decreased levels of GABA. And GABA reduces neuronal excitability and promotes calmness and relaxations. So it makes sense that decreased levels of these could amp you up and make you feel anxious. So what are the treatment options that someone has if someone is suffering from GAD? So first, there's pharmacological treatments. These are medications that will often be prescribed. The more common ones right now are selective serotonin reuptake inhibitors, SSRIs, and selective norepinephrine reuptake inhibitors. These are agonist medications that create more of these neurotransmitters in the synapses, which reduce symptoms. Another common medication that's prescribed is a benzodiazepine. These are more intense drugs. They're very helpful at getting rid of the symptom quickly, but some downsides is that they can be habit forming and also cause more side effects than the others that are available. Some psychological therapies that are available to people suffering from GAD is cognitive behavioral therapy, abbreviated CBT. This is a drug-free therapy that's actually been shown to change the brain, which is a really cool study that I linked of the changes that are happening. And some of those changes are what you would expect for something that could treat generalized anxiety disorder. It actually decreases the activity in the amygdala and increases the activity in the prefrontal cortex. Also, people could practice mindfulness, which is a type of meditation where you just focus on the present, and sometimes you'll focus on your breath and just take your mind off things and off of worry. There's also common lifestyle changes that people can make to help with the symptoms, such as regular exercise, healthy diet, and sleep hygiene. So, final thoughts here is that there is ongoing research. The brain is obviously a super complicated organ that we don't know absolutely everything about what goes on in it and what causes certain things, but we've had a decent idea with GAD through fMRI studies and the like. Also, GAD is a relatively common disorder, so an estimated 5.7% of the US adults at some time in their lives have experienced the disorder, so That's a lot of people. That means every 100 people that you meet, about 6 of them at some point in their lives will suffer from generalized anxiety disorder. So I think it's important to know and recognize what this disorder looks like. Also, I would encourage stress management for most people. I think it's important for everybody. Everyone gets anxious and gets stressed out from time to time. So these drug-free therapies that are available can be helpful to everybody. But it's also important to note that if these symptoms persist and regular stress management doesn't take care of them, it's important to visit a medical professional who could possibly diagnose you with generalized anxiety disorder and get you on medications that could be helpful for you. So, yep. And here's my references. Thank you guys for listening.